Hi, I'm Justin Nutt, CEO and founder of Nurstead Mental Health and Consulting Services. We were asked to share with the community what a mobile crisis team is, what they do, and how they can help.
And I'm James Avalar, Director of Treatment with Nurstead, and part of the role that I serve is overseeing our mobile crisis team.
Nurstead has been doing crisis work for over a decade in one way or another. We have worked with thousands of people in crisis in that time. In 2023, we began providing mobile crisis team services in Roosevelt and Curry County, New Mexico. And we were one of the first certified mobile crisis teams in the state of New Mexico.
A mobile crisis team, or MCT, is a team of specially trained behavioral health professionals like therapists, community support workers, and peer support, who respond to crisis whenever and wherever they might occur. Traditionally, where mobile crisis services don't exist, individuals who are in crisis are taken to the ER to be assessed and determine if that person needs to be admitted to an inpatient hospital. The reality, though, the majority of people who are seen in crisis have no need for placement. They have a need for help in that moment, and that's what we provide.
Crisis can look like a lot of things. And while we do assess for what we call imminent risk, and if hospitalization is appropriate, we do much more than that in most cases. Most of the time, hospitalization isn't needed. We provide de-escalation, coping skills, intervention, stabilization services, help to create a plan, and then follow up with that individual after those services are provided.
A mobile crisis team provides immediate on-site mental health support to individuals experiencing a behavioral health crisis, either in their home or in the community. And our goal is to prevent hospitalization or incarceration. Nurstead believes that crisis is defined by that individual.
Where mobile crisis teams truly differ is we're there to address the problem, de-escalate the crisis, and create a next step. We aren't just there to determine if someone's going to be admitted or released. In fact, out of the over 400 calls that we've responded to in the last 2 years, we've only had around 15 individuals where they were transported and admitted to an inpatient facility.
MCTs are trained to respond to most types of crisis and resolve the situation with the individual or their family. Individuals having suicidal thoughts, situations where a victim of a crime is distraught or highly emotional, individuals experiencing manic symptoms, depression, or anxiety. We can also assist families with processing the death of a loved one, either by suicide or natural causes, and so many more situations.
That said, while mobile crisis teams can address most any type of crisis, and we're happy to respond to calls where we can be of assistance, there are those situations where we're not the best ones to address that crisis. Some examples of this may be an elderly person who's experiencing dementia or confusion, a teenager who is fighting with his or her parents, but there's no mental health symptoms present.
Medical emergencies are when someone has already attempted to die by suicide, and individuals who are highly intoxicated or impaired by other drugs. These situations are ones where we can assist through outpatient therapy as a follow-up service, but in that moment, an MCT response maybe isn't the best option.
While we hope those watching don't experience a crisis, we do want you to know that Nurstead, as your local mobile crisis team, is here if you are. And we're available to respond 24 hours a day, 365 days a year. If you need our services, you can reach us by calling 575-201-HELP. That's 575-201-4357.